Good evening, good morning to you all. My name is Dr. Gladwell Gathecha, working at the Ministry of Health in Kenya. I'll begin by thanking the organizers of the TTT Curriculum Review meeting for the opportunity to present, and I'll go straight to it. This slide, I put it here for you to get an appreciation of the level of trauma in the country. It shows the leading cause of death by age group. For the age group 5 to 14, we have road traffic injuries at number 5, we have drowning at number 9. For the age group 15 to 49, we have violence at number 3, road traffic injuries at number 5, and self-harm at number 10. For the age group 50 to 69, we have road traffic injuries at number 9. So straight away into the journey of TTT. In 2016, we had trauma care stakeholders. It was agreed that there was a need for unified training for the healthcare workers who worked at the facilities at primary and secondary level. This is because here we find nurses, we have clinical officers, you have medical officers who did not have any training other than the time they were in college or university. So it was found that there's a gap that needed to be bridged. So 2 years later, in 2018, we had our first TT training. We trained 25 trainees, and it was a providers training. In 2019, we had 2 trainings. This time we also had an instructor's course and a provider's course, and we trained 59 trainees. This year we had plans to train another 50, but due to the COVID pandemic, this was not possible. In terms of cadre, we've trained 4 surgeons, 4 orthopedic surgeons, 5 anesthetists, 8 medical officers, 1 emergency medical technician, 25 clinical officers, and 29 nurses, bringing a total to 77. So for Kenya, healthcare is largely devolved into counties, and these counties are responsible for their health. So these 77 healthcare workers come from 8 of the counties. So there's another counties we still not have covered. And I'll explain some of the challenges we are facing. This is one of the training sessions where people were being trained on their skills. We've had positive reviews on the TTT. People have said that it's well organized, that they've liked everything, though the time allocated was short. Some say that we should increase the time to 5 days instead of the 3 days for the providers. Then they asked for more practical skills, especially management of injuries of the extremities. The training was considered great, and it should be moved to facility level, so the trainings to happen at health facility level. And it was agreed that the courses were in line in what they were doing or how at the outpatient clinic, that it was in line with their daily workings at the outpatient clinic, though they say that more resources should be allocated for the practical session. We've had people who have worked with this journey together. The Ministry of Health is one of the funders, but in it we also have funders from Innovative Canadians for Change. Canadian Network for International Surgery has also provided faculty. Dr. Let was one of came to teach during the last TTT training. The World Health Organization has also provided funding. Kenya Red Cross and the International Committee of the Red Cross have provided equipment and supply for the trainings. Muhimbili Orthopedic Institute provided faculty for both the second and the first training. So much appreciation goes to these institutions. We've achieved what we have because of their support. We've had some challenges along the way. The first one, funding. We would really like more of our healthcare workers and more of our counties to be involved, but due to the funding challenges, this has not been possible. Number two, the professional organizations have not fully embraced this training. This is largely the surgeons. So for them, they prefer ATLS to be used, to be the course of choice for healthcare providers. But due to financial constraint, this has not been possible. And that's why, as a ministry, we've embraced TTT to fill this gap. There's also a lack of prioritization of trauma care capacity buildings by counties and other partners. Since the counties are the ones responsible for matters health, it was up to them to take up TTT, but there's been a bit of reluctance due to other competing priorities and other issues. And then some skill sets are not permitted in some certain cadres. For example, nurses are not allowed to perform card downs. What we have in store for TTT, we hope to roll out to more counties, meaning more healthcare workers. We also want to register the course for CPD accreditation. And we are currently developing a national trauma framework. And this framework has recognized TTT as a key training for healthcare providers. And then we also want to source for more partners to support this. So we had envisioned to conduct a funders meeting in May so that we interest both the traditional funders who may be interested in trauma, but also to try and pitch into other funders who may not have maybe been working in the area of trauma, but show some core benefits and at least urge them to support the area of trauma care. As I conclude, what are some of the lessons we've learned that partnerships are crucial to ensure sustainability. Interest among the healthcare workers is high. We've had no significant dropouts during the courses, and we didn't issue any threats. It is just out of goodwill. Interest to start trauma registries among the healthcare workers is high. So the training should be utilized to initiate trauma registries. We found were not prepared for this. So as much as we would have wanted the counties to pick up registries, during the training we were not prepared, and we said, let as much as they were thirsty for this, we told them to hold on a bit. So high level advocacy in counties to get buy-in for scale up is crucial. This is because we want, after you initiate the first set of healthcare workers, we want the counties to take this up. And then we also want to ensure that they also provide the requisite equipment and supplies for trauma care in the facilities. And lastly, the choice of who gives lecturers is important in terms of cadres, because in the last meeting we found reviews that some people did not teach up to par. Maybe it was more of a limitation of their personality. I'd like to thank you all for listening to me.